And can you talk a little bit about biofeedback and electrical stimulation?
Mhm. So we use those when we need those. We have found that our hands do great, but there's some patients who either need to take something home or they need a little more extra feedback. And so we can do biofeedback and external stim in two ways. We can apply those electrodes externally. We can put them on the abdomen. We can put them on the area of the glutes. And biofeedback is a device that we can use electrodes and or sensor pads more so that hook up to the patient and it gives them a box, or we hook it up to a computer program and it's able to sense the muscle activity at the pelvic floor muscles. So when we ask them to contract, it may be, if they're just holding on to the device, it may be some bars that raise up. If they're working with a computer program, it may be a flower that opens up and expands, or it could be balloons popping. It can get quite creative depending on the program we're using. Um, or if we're asking them to relax, it goes the other way around. And so we can give them and tie a visual feedback to what they're doing functionally. On the other hand, if somebody's having a very hard time contracting their muscles, we can hook up electrical stim. Same thing, it can be applied externally or internally. And I can tell you that might sound a little frightening, but unlike many other medical professionals or professions, physical therapy is one where anything that we do to a patient, we've actually had done to us. And so electrical stim to the pelvic floor is something I have had done to myself as well. And it is simply inserting a probe and giving I know this sounds terrible, but a little bit of an electrical charge to those muscles because muscles do work on electricity, but it feels like a pressure. That's what it feels like to you as the patient. It feels like a pressure, and you can feel that pressure right in your pelvic floor. And it helps those patients find those muscles and work them. And so those are two of the tools. The other things we can sometimes use for women, we can use pelvic floor weights. We don't use those for men. They're inserted vaginally. They don't tend to work so well inserted rectally, so we don't use them. But for a woman, we can actually use a pelvic floor weight, which also gives them that pressure sense to help strengthen the muscle over time and incorporate into their daily program.
It's great. Thank you very much. So a couple of things. I'm going to have Dr.